Okay, I'm going to speed talk because this is round number 3 and I almost went to 17 minutes in my last video. So my name's Alexias Barry. This is my 10-minute head-to-toe health assessment. This is Shane, my fiance. So to just jump right in, I would begin by gathering all of my information about the patient before I enter the room. I would want to knock. I would want to provide privacy. I would want to introduce myself, who I am, what I'm going to do or want to do with this patient. I'm going to verify his name and his date of birth. And so make sure that the patient is in a great upright position. So I want to get to know about this patient. I want to know about his medical history. I want to know his blood pressure, his pulse right now. I want to know his weight. I want to ask him if he is having any pain right now, and if he is, I want to use the pain assessment skill depending on who he is and what his level of awareness and consciousness is. So I kind of want to just get a general overall about him, where he works, does he have kids, what is his social life, what is his cultural beliefs, how does he define health, how does he define his wellness, what is his diet like, what does, sorry if you can hear my chihuahua in the back, he's super upset, he cannot see us right now. Anyways, so yes, I would just kind of want to know if he's on any medications, if he uses any herbal remedies, anything like that. So basically, I'm asking everything I absolutely possibly can about this patient that I can use or that we as a healthcare team can use to help this patient. So beginning with the head, I'm just going to inspect the head, see if there's any bumps, abrasions, lesions. This is a part of integumentary system, feeling for temperature, color. Like I said, look inside the ear. I'm going to want to look inside the mouth, say, any lesions, ulcers. Same thing with the nose. Looking at his eyes, any redness. So intelligent nurses must check prescriptions regularly is kind of what I'm following. But I'm using it in the format from head to toe. So that's kind of why I'm all over the place, but I'm trying to hit all of the body systems. So with the head, I'm going to check his pupils, dilation. Okay, great. Skin looks good. Everything looks good. I'll have you follow the pen. Okay, great. Have you rotate your head all the way to the right, all the way to the left, and up, and down. And can you move your head in like a circular motion? Okay, and you smile for me? And you frown for me? Okay, can you stick your tongue out? All right, and so that was part of the kind of musculosystem and neurological system. And the last thing that I want to do is just kind of feel his face. Okay, you felt that. And does that feel the same? Does it feel different?
Nope,
any tingliness?
Nope.
Great. Okay, so we'll move on to the back. I'm just going to listen to his lungs. I would obviously want to clean my alcohol, or use an alcohol pad to clean my stethoscope. So I'm just going in a perpendicular motion from left to right and then moving down. Left to right. And just for the purpose of time, he would obviously inhale, deep breathe with each of my movements. But just for purposes of time, we'll just say we did when we didn't. So I'm going to auscultate the back. I'm going to check the back for any lesions, temperature, pressure ulcers. Is there, a curvature, correct curvature in her back? Is there any deviations in the spine? I would also want him to rotate his neck this way, kind of watch his neck. Okay, great. And so we'll begin with listening to the chest. Like I said, for time purposes, we are just going to pretend in and out, in and out. You don't have to breathe that fast. It's okay. You can breathe normal. But we're moving in a Z pattern. And then we're going to move outward. Okay? And this is a part of listening to the lungs for crackles, bronchi, any wheeziness. So while he is sitting up, I'm just going to go ahead and listen to his heart too. We're going to find the sternum. And then just a little over to the right. Going to listen to all 4 parts. Well, 4 or 5 parts of the heart. 4th or 5th intercostal. Okay, great. So before he lays down, I'm going to want to inspect his arms. Okay, great. Great, great, great. All the way out. Okay, don't let me push your hand down. Let me push your hand down. Let me push it up. Okay. Oh, I almost hit you in the face. Okay, so we're going to want to listen to the radial pulse, or feel the radial pulse, excuse me. Feel the radial pulse. Okay, great. And then just to quick jump back up to the head, I would also want to assess his neck and feel for his carotid, any lymph nodes that are swollen, any tenderness. Kind of feel the trachea. Okay, so I looked at the musculoskeletal, the neurological, the integumentary, the cardiac. So we're going to go ahead and have him lay down, and I'm going to assess his bowels. So beginning, I'm going to ask if there's any tenderness. If there is any tenderness, I'm gonna stay away from that spot until last, just so it doesn't irritate the area. So like I said, clean my stethoscope. Gonna begin by just inspecting the skin. Okay. Any lesions, any redness, anything out of the ordinary? Is the stomach distended? Is the stomach, is something abnormal about the appearance of the stomach off the bat? Okay, so moving from the upper right quadrant over clockwise, we're going to palpitate, looking for any tenderness, any lumps, any hardness. Great. And then we're going to percuss, moving clockwise from the upper right quadrant. Awesome. Okay, now we'll auscultate the bowel sounds. If there is no bowel sounds, there would have to be nothing heard from each quadrant for 2 minutes. We're wanting something from 5 to 30 seconds for bowel sounds. Nothing continuous, but just intermittently from 5 to 34 seconds. Go ahead and do that now. Okay, great. So that is our gastrointestinal. So we are going to jump down to kind of the legs area. So beginning, we're going to start with intelligent, integumentary. We're looking at the legs. We're looking for redness on the heels. Capillary refill, that's a part of respiratory, pulmonary. We're looking at, does he have hair on his legs? Where is there patches of hair missing? Is there any edema? That's a part of the cardiovascular system. You would want to ask him to walk for you to see how his gait is. That's a part of the neurological system. Has he had a stroke in the past? Is there a reason why that maybe some of these abnormalities that I'm finding make sense? So we're just looking. We're going to find pulse, back of the leg. And then we're going to find it in this side. Sorry, you can't really see. I'm going to use your foot, babe. Find the popliteal. So just feeling for all those pulses. Like I said, looking at the skin. Watch his gait. I would want to see any edema. And then I would, if this patient, was a total care patient, I would want to obviously undress them. I would want to inspect their peri area. I would want to inspect their buttocks area, especially, like I said, if they're have limited mobility. Pressure ulcers can be there, especially on the coccyx. Looking for capillary refill. Okay. So I think that is all. I would obviously help the patient, back up. Here, I'll help you back up, babe. I would just kind of want to go over the assessment with them and help them get dressed. I would perform hand hygiene and then document my findings. So thank you very much, and I hope I didn't miss anything.